heart center baka. Okay. So let's first define the flow diversion. Ano? So this minimally non-invasive interventional radiology procedure in catheterization laboratory using a fluoroscopic machine. Using catheters and wires inserted from femoral access, and it also deploys this is a stent that helps to divert the blood flows and prevent the aneurysm ruptured or burst. So this since procedural procedure ano to ano special procedure. So let's first discuss the cerebral arteries associated with this procedure. So the cerebral arteries anatomy. Ano? So we have the three main branches, which is the anterior cerebral artery. They supplies blood to medial portion, which is the frontal, and also the anteroparietal lobes. And the next one is the middle cerebral artery that supplies blood to the majority of the lateral portion, and also includes the lateral, temporal, and the lateral parietal lobes. And the last one is the posterior cerebral artery that connects to the posterior part of the portion of brain, so which is the cerebellum and other portion. So as you can see in the picture, the arteries that are associated to the main aorta, there are two common artery, ano? So yung isa is branch siya from subclavian artery to the main branches, and the other one is nakakonect siya through the main aorta. So the common carotid artery ano, is divided to external and internal arteries. So the external arteries are branches to the neck part of the body, and the internal arteries, which is the connected to the main brain part of the arteries. So kung makikita nyo din, pinicture ko lang to, the circle of Willis, which is the yung common na nanggagaling ng ating aneurysm. So it forms the aneurysm all throughout the circle of Willis kahit saan banda dyan. Because since the circle of Willis has the higher pressure, kaya siya pabalik-balik lang yung mga blood natin throughout from the heart. So minsan, kadalasan talaga is the circle of Willis is the more common na cause of ruptured or unruptured aneurysm. So, bago tayo pumunta, no, so kilalanin muna natin bakit ba nagkaroon ng cerebral aneurysm or bakit may cerebral aneurysm, ano? Or ano ba talaga yung cerebral aneurysm? Sorry. So the cerebral aneurysm, also called the brain aneurysm, and it's a weak or thin area in the cerebral artery that bulges out and fills blood. So pag tumataas yung pressure doon sa part ng aneurysm, so may mga possible na pumutok siya or kumalat sa buong brain. So which is called also brain hemorrhage. So we have the indications. So this is the common indication ano sa brain natin. Ruptured aneurysm or the unruptured aneurysm. So this is type of kinds of aneurysm ano. So this is the saccular, which is commonly seen in the brain. So the falciform also dissecting aneurysm also nakikita siya kadalasan sa mga aortic abdominal aortic uh, main branch. So, proceed tayo. So, we have the minimally invasive catheterization technology. So, kung makikita ninyo, so this is the interventional radiology procedure. So, most commonly, talaga, ginagawa siya sa cath lab. So, yung cath lab natin, has different kinds of procedural na ginagawa. So, either cardio or radio. So, so we have the fluoroscopic machine. So this is the fluoroscopic machine na ginagamit lagi doon sa Philippine Heart Center namin, doon sa room 2 namin. So doon yung mga gamit lahat, pinicturean ko lang siya. So it's a fluoroscopic machine, so providing real-time X-ray imaging, which is particularly useful for guiding various interventional procedures. So there is also application for the C-arm, the digital subtraction angiography, which is commonly called the DSA. So we have the roadmap and 3D RA. So digital subtraction diagram. So kung makikita nyo sa picture, yan yung types of images na nakuha ko. So fluoroscopic technological advances use interventional radiology to visualize broad arteries. So yung digital subtraction angiography is very useful to help the operator or the doctor or interventional radiologist to identify kung saan nila makikita yung associated na aneurysm. And this one is the roadmap. So kung makikita niyo yung pagkakaiba ng roadmap and the digital subtraction angiogram lang. So dito, may mga mas makakatulong po sa doctor kung saan nila idadaan yung mga wires na gagamitin throughout the cerebral arteries. The 3D RA. So the 3D RA generates 3D volume dataset from a single C-arm rotation. So at least 180 plus fan angle. So umiikot to, tuloy-tuloy, around the patient during continuous injection of contrast. Yan. So tuloy-tuloy siyang iikot. Then injection of contrast to 3D. Then after mag-inject ng contrast, titingnan ng doktor doon sa monitor yung 3D, which is the kung saan yung aneurysm nakalagay. So this is for the basic interventions materials. Yan. So this is the guide wire catheter uh, designed to provide a pathway through which is therapeutic devices are introduced. So sa interventional cardiology, marami din na mga catheter. Madami kasi mostly hindi din mahirap makuha yung mga arteries na kailangan nilang pasukan ng catheter. So dito naman sa interventional radiology, meron specific lang sila na minsan ginagawa yung sa experience ko lang doon sa cath lab sa Philippine Heart Center. So iisa lang yung minsan yung ginagamit nila na guide wire or catheter. So it is the pero uh, may iba-ibang mga company na meron din ang catheter. Okay, so that is the part of catheter. So the outer jacket. So sa loob nito is inner coating. So this is the guide wire. So a guide wire is a device used to guide the catheter into place during the insertions of and purposely a guide wire gain access to the blood vessels using a minimally invasive technique. So dito, pag pinasok ang guide wire at catheter, yung guide wire is ginaguide niya yung catheter para doon sa kung saan yung area na papasukan ng uh, stent. No? So the next one is the microcatheter. Microcatheters can be described as a thin wall or small diameter tubes are used for the guide wire support. So this is a guide wire support, exchanges to the access distal anatomy. So yung mga maliliit na mga ugat sa brain, kaya niyang, kung halimbawa may guide wire na hindi kayang pasukin na yung maliliit na ugat. So gagamit sila ng mga microcatheter. So marami din yan na may mga microcatheter, iba't ibang klaseng company. Uh, may Mirage. So kung hindi kayo familiar, pag pumasok kayo sa interventional radiology, makikita ninyo madaming mga company na ino-offer yung mga may So hindi lang ako nakapagkuha ng video nito kasi medyo nakulangan sa oras. Tapos busy lang din. So let's forward the flow diverters material So yung mga intern dati, tapos ngayon, siguro familiar na dito kasi nakikita nila lagi doon sa interventional radiology. So, this is the long sheet, yung ginagamit natin. Infinity Striker, so this is a company din. We have the guiding catheter, the catalyst, 5 French, 115 centimeter. So, sample lang to, So, kasi nakadepende pa rin sa ugat ng pasyente. So, kaya ang anong klaseng catheter o microcatheter ang gagamitin. So, we have the microcatheter XT27 na may mga sizes din yan. Microguide wire, the Synco 14, 140 to 200 centimeter. And the most commonly, ito yung ginagamit na assistant as to divert the pressure na blood is the involved FD strikers. So ito yung stent na ginagamit sa flow diversion. So flow diversion na stenting So di bali dito kung makikita nyo sa image yung aneurysm na nawala na nang malagyan ng stent. So, yung iba medyo hindi pa familiar, kasi medyo challenging din tong procedure na to. Pero pag andun ka sa Katlan, yan. So, ina-assess mo lang yung mga doctors natin, operators, kung anong mga gamit yung gagamitin nila. And sa rooms. So, this is a sample of aneurysm. So, kung makikita sa 3D, yun yung aneurysm. Then, sa digital subtraction, yun yung aneurysm. So, bago gumamit ng stent yung mga doktor, So, after nila i-angiogram yung procedure, din makita nila sa 3D yung aneurysm. So, susukatin nila ito. So, yung through the modern technology ngayon, so, yung ginagamit kasi doon sa Philippine Heart Center na yung Philips na old. So, yung ngayon sa ibang bansa, siguro high-tech na. Isang na lang, alam na nila yung so parang during the procedure, kaya nilang i-detect yung stent na gagamitin at yung haba ng stent na gagamitin. So yung stent natin na where yun So dito sinukat na nila. So the orange color yan yung diameter ng vessel na papasukan ng stent. Okay, then yung blue, yung kulay blue, yun yung haba ng stent. So measure nila 2.73 and 13.42 or either 12.55. So ngayon, iba't ibang sizes kasi yung stent natin na ginagamit doon sa interventional radiology using this flow diversion technique. So pag nasukat na nila, kukunin na nila ngayon yung size na nakuha nila doon sa paglalagyan nila ng stent. So, this is the picture lang, no? So, wala tayong nakuha. Hindi tayo naka-prepare ng video. So, yung unang picture, ayan sa taas, sa left side, uh, pinasok yung catheter and a microcatheter also, andoon sa pinakapagdulo. So, sukatin nila ngayon. Then, habang tinatanggal yung pipeline na yun, so lumalabas yung stent. So, kung makikita nyo dito, habang hinahatak, lumalabas yung stent na yun na nagpro-provide na takpan yung neck ng aneurysm. So, depende din sa neck ng aneurysm, nakadepende kung ano yung gagamitin. So, we have also cerebral coiling, which is binabarahan yung aneurysm mismo para wala nang dumaloy doon sa uh, pressure or bulges. So, ito naman is gumamit sila ng stent dahil yung flow diversion technique gumamit sila dahil yung neck ng aneurysm is medyo maluwag na. So parang hindi niya kayang isupport yung coil na gagamitin dyan sa loob. Baka matanggal lang kapag may cerebral coiling lang sila. So yung FD, so tinatawag ko, ito yung kaninang sinabi kong na striker. So kung doon sa heart center, nagkakahalaga siya ng 500,000, ano, isang stent lang yun. Mga 500 mil, I mean 500,000 plus, gano'n. So, yun ang kahalaga niya. So, kaya maingat sa paglalagay yung mga doktor. Very challenging lang. So, mostly yung na-assist ko doon is 6 hours. So, medyo matagal talaga. At doon kami for 6 hours sa loob ng uh, room. Pero pag madali naman yung procedure, mostly umaabot po ng 3 to 4 hours. Depende. So, yun yung pinaka mahabang oras doon sa Philippine Heart Center. So, pagkalagay nila ng stent, yan. So, ito yung tinatawag na flow diversion. Ano? So, kapag binagyan ng stent dyan, yung pressure na pumupunta dyan sa loob ng ugat is hindi na pupunta sa aneurysm. So, tinutulungan ng stent na to na hindi pumasok lahat ng pressure doon sa aneurysm. So, ayan. So, yung pressure, nagda-divert siya to the stent, uh, to the help of the stent. So, hanggang sa gumaling mo lang, dire-diretso. So, okay lang po. Nakuha po. And this will be the last slides po. Salamat po sa inyong lahat.
Thank you, sir.
Thank you so much, Ruben.
Thank you po.
Talaga si Ruben, big time na.
So, may questions po. Tanong lang po kayo.
So, next is
Sandali lang ko no, sir, kaya nag-share screen pa.
Um,
Stop share muna sa imo screen.
Okay.
Yung,
Sir, my question daw po si Mr. Mark John Sherbo from BSRT level 3. Pag may pakya naman 3 to 6 hours daw po kam sa room. Pag may aon daw po sito na case, di ba continuous man an exposure siton. So after
Yes,
sa
sir.
procedure, may aon ba siya mga nafe-feel or reaction
Okay.
something?
Siguro sa experience, bago, bago pa lang ako pasok ko sa Catlab, naka-experience talaga kasi minsan nakakaupat na upat nga procedure nga puro long. So almost 2 to 3 hours doon kada procedure. So nakakaramdam talaga ako. Pag ulit nakakaramdam talaga tantay sa kanawasan. So sa ulo, then ano. Sa'yo man lang na experience sa ako at sa adto ka na talaga siguro ah parang nakukuhan sa hindi mo body na laan lawas an radiation kay nakakuan man ka mo since naka-shield naman ka mo so naka-abdominal shield or around the rock so kapag sige-sige na lang parang nakaka-absorb mo na lang kanya kuan radiation nga nahinga to sila parang hindi rin mo na mapipil paminsan-minsan so ay may nagawaray mo Tagalog sorry
Tagalog dapat ngayon. Okay lang.
Sir, my
sorry
question
sorry
po
sorry baka may nakikinig na
Another question coming from Mr. Kurt Cyril from BSRT3B. May po ba chance na bumalik yung aneurysm sa specific area na gin-perform ang procedure, something yun?
Yes, so possible na may ano siya, mga risk after the procedure So by time to time pinapacheck talaga siya nga pinapacheck kasi dati kasi waray kuan gumagamit la sira surgical clipping. So hindi rin ko wala ko nakakuan kasi wala ko na-discuss. So di kuan nagka-craniectomy lang sira. Luluho talaga ang kuan tapos an aneurysm is iniipit dati wari pa mga solusyon. So kapag sa stent naman kasi possibility na may mga recurrence nga pwede mahinabo, blood clotting, thrombosis, mga sabs doon.
Thank you, sir. Thank you, thank you.
Uh,
Sir, another questions pa po from Christine Perito from BSRT Level 3B. Ano po yung most common type of cerebral aneurysm na ginagamitan ng flow diversion technique?
okay. Kind of aneurysm is the secular kanina na unang diniscuss natin. Yung saccular. Common type yan. Mostly kasi doon sa Philippine Heart Center, puro brain aneurysm lang talaga yung ano, brain aneurysm lang talaga ang pinoflow diversion. So, may embolization naman pero kadalasan.
Sir?
Yes, yes. Oh.
Sa lahat daw po ng procedure na done to treat aneurysms, what is the most common used po? from BSRT Level 3, Charlene Sinobio.
Sorry, ano ulit? Sorry.
Sa lahat ng procedure done to treat aneurysms, what is the most common use po?
Depende. Depende sa aneurysm niya. Kasi yung aneurysm kasi may yung neck niya. Halimbawa, yung neck niya is maliit. So, possible na kaya niyang gawin yung other procedure, cerebral, like for example, cerebral coiling. So, pagka yung aneurysm naman is yung niya is maluwag, possible kahit hindi na i-coiling as a diverter, most commonly, flow diversion yung ginagawa.
Dire. Tomato ketchup to. Wala.
So, meron naman technique,
Sir.
naman share ko lang, meron din na technique, na kapag andun. So, minsan, dinodouble stent nila, then coiling. So, minsan, kinukoil nila yung aneurysm, then nilalagyan pa ng flow diverter stent. So, depende sa indication, symptoms, or problem ng pasyente.
Okay, sir. Thank you, sir.
Thank you din. Salamat po.
Thank you, sir.
Okay. So, picture taking muna guys. Please turn on your cameras. Stop share.
How do I do?
Ramskin, ano pag rim ari? Ate Kams.
Ready? 1, 2, 3, smile.
Wala palit ka mo nabong ni Camille at screen.
Okay, next group. One, two, three. Smile.
Thank you, sir.
Thank you po.
Thank you, Raven.
Salamat tayo,
Igano na lang, i-address ta na lang, kaya i-address ta na lang personal account.
Salamat, sir. Salamat.
Thank you so much, Rio.
Thank you, Rio.
Hindi ko na nag-click. Ang gimmick, ha? Timog.
Gimmick kita, sir, pagpaka di mo.
Oo. Di man mo PF ko na pang gimmick natin. Sige. Share screen. Sir Rachel, change outfit. Sino ka ngayon, sir? Anong peg mo?
Same. Same lang po.
Big Min. Tindahan man to, Big Min.
Ay, mag-open pa ba camera?
At this juncture, let us present the certificate of recognition to issuance of certificate to Mr. Ruben. Sir, dala ka na. University of Eastern Philippines, University Town, Northern Samar, Certificate of Appreciation is hereby awarded to Reuben Villis, RRT, for sharing his expertise in flow diversion technique for cerebral aneurysm over during the webinar entitled One Heart UEP RadTech via Zoom and Facebook Live, given this 7th day of February 2024. Signed by Christine Camille Javines, MSRT, RT Program Chair. Signed by Sarah B. Delarino, PhD, College Dean. And signed Dr. Cherry I. Ultra, PhD, University President. And
Thank you so much, Sir Reuben. Basta ang
Thank you,
gimmick.
sir.
So much, sir.
Basta ang
Thank
gimmick
you,
mo.
sir.
Salamat, Rio.
Salamat, salamat.
Thank you, sir.
Salamat.
Okay. Shout out to our Facebook viewers all over the world. Welcome, everyone. Hello, NSPH. Sir Donald. Trump. Hello, everyone. Hello, sir. So let's take a short break and get ready for this intermission number prepared by our duo, Miss Carla Balanday and Mr. John Paul Oreo.
Your eyes in the morning sun, feel you touch me in the moving rain. At the moment that you wander far from me, I wanna feel you in my arms again. Arms for the sun, see me walking up and sorry. Nothing but how in the I really need you. Cause You must say no and for and I can fall. I know that inside of me it's feeling shallow. How we did all of how we made time. Never forget you know the cause of the very song. You're the deep and darkest song. You can say your mountain for the sun of praise. If you want me love, then it's all me. It's feeling the shadow. I deep in your love, really need your love. Cause of the way
Ibigay ang mic at Sir Andrea.
Thank you, Ms. Balanday and Mr. John Paul Arya. Thank you. I thank you sa mga dancers at the back. And nag-record, Ma'am Christine Havines. Grabe. May I invite Ms. Rian Galigor to share to us the synthesis of our event's key points.
To end this webinar, I will be sharing my take on these topics presented by our guest speakers. So, multimodality is integrated different modalities to better diagnose on the patient's condition. This is essential as it makes an important innovation in a role of procedural guidance. Its advantage comes with challenges, and one of those is its availability. A more advanced technology will cost more, run, and demand financially from patients. On the second topic about the flow diversional technique for cerebral aneurysm, flow diversion technique is a neurointerventional technique used to treat cerebral aneurysms. It involves deploying stent-like devices across the aneurysm's neck, diverting blood flow away from the weakened blood vessels. This technique is effective. This technique is effective on the complex and wide neck aneurysms, offering a less invasive alternative to traditional surgical methods. However, it requires careful patient selection and ongoing monitoring for potential complications. As a future radiologic technologist, this webinar opened our eyes into different perspectives, and having our experts to share the knowledge is beneficial for us students to widen our horizons in the techniques and modalities. And that would be all. Thank you.
Thank you, Ms. Bellador. Okay. As we come to the culmination of this remarkable event, it is my great pleasure to introduce our BSRT President, Ms. Jasmine De La Cruz, for her closing remarks. Sorry for nakamute kasi ang so again, to our very active university president, Dr. Cherry Ultra, to our college dean, Dr. Sara De Lorino, to our program chair, Professor Christine Camille Susaya, to our BSRT faculty members, to our guest speakers from none other than Philippine Heart Center, Mr. Gilbert Pedroso and Mr. Reubin Revellies. To my fellow BSRT students in attendance, a pleasant morning to all of you. This webinar's primary objective is to provide you with useful knowledge on cardiac imaging through the lectures of our prominent guests. The subject that our guest speakers covered are extremely relevant to the celebration of National Heart Month. The importance of fusion imaging and multimodality imaging approaches in improving treatment planning and diagnostic accuracy has been brought to light in this webinar by Mr. Gilbert Pedroso. In addition, Mr. Reubin Revellies talked about flow diversion ways to cerebral aneurysm, has highlighted how crucial it is to use innovative methods in order to improve patient outcomes. It is essential for healthcare workers to be aware of these improvements. I would like to emphasize as well the significance of continuous learning and collaboration among professionals from different disciplines to further refine and optimize these imaging techniques. To our BSRT faculty members, especially Professor Rongel Estinilo, we thank you for allowing us to execute a huge event like this. Being able to collaborate with the country's most notable hospital, the Philippine Heart Center, will not be possible without your assistance. Thank you, Mom. Thank you, sirs and Mom.
our guest speakers, Mr. Gilbert Pedroso and Mr. Reuben Rebellius. Thank you for sharing with us the necessary knowledge about cardiac imaging. To our fellow BSRT students, thank you for sparing us some of your time. To BSRT 3 officers, thank you so much for making this event possible. I encourage everyone to apply the knowledge gained from this webinar as radiologic technologists and aspiring radiologic technologists. Thank you once again for your attention and active participation. Let's continue to work together to make a difference in the lives of our patients. Your one heart is all it takes. Stay safe, everyone. Thank you.
Okay. Thank you so much, BSRT President, Ms. Jasmine de la Cruz. Before we end our webinar, let's take let's have another intermission number from the BSRT 3A, the Chihuahua group.
I just wanna love you like I do, cause I never had someone like you. I can't know to make every nigga holler. Raindrops falling on the rooftop. Ooh, baby, tell me why'd you have to go? This pain, I feel it won't go away. And today, I'm officially missing you. Can't nobody do it like you. Say every little thing you do. Hey baby, say stays on my mind. And I gotta move on somehow. that flow then. Now lean then. Turn around then. Turn around then. Now wiggle, 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 wiggle. Play dead like. Then. Strike a pose like. Then. Check the lady like.
Mga hinala di magagawa dahil kahit lagi kang ganyan, madalas ko mang di maintindihan. Ay, ikaw pa rin naman ang siya nais kong haggan, kaya mahal, kumapit ka lang. Di kita bibitawan, ikaw ay paglalaban ko. Heto na naman naririnig, kumakapa-kapa itong dibdib. Lagi na lang sinasabi, pwede ka bang makatating? Kahit sandali lang, sige na, sana'y pagbigyan. Pwede ba? Mukhang tinamaan, kaya na ako. Kapag tumibok ang puso, wala ka nang magagawa kundi sundin ito. Kapag tumibok ang puso, lagot ka na, siguradong huli ka.
Thank you, Chihuahua Group. Okay, before we end this webinar, I would like to call on Professor Rangel Istunilo for further announcement.
Okay, thank you so much, Miss Christine Erica Go, and to the Chichiwawa group. Ganda ng grupo. Nabuo lang ngayong webinar ng One Heart, One Heart UEP Radtech. So anyway, thank you so much to our, of course, to our lecturers from the Philippine Heart Center. Thank you so much for your collaborative learning that we had today. Without your expertise, we cannot do this. And of course, our main intention here is to prepare both our level 3 students, to prepare them for internship program, and to our level 4 to prepare them as soon they emerge as our professional radiologic technologists. And to Mr. Reuben Revelias, so we are proud of you here in the UEP Radtech, our alumnus that is now our guest speaker. Okay, so to our level 3 students, to our level 4, so we have a webinar, upcoming webinar on March 3, 2024. Of course, that will be entitled Baby One More Time. Yes, parang Britney Spears. So that is all of our focus now is on the fetal imaging. Yay! So that is in celebration with the International Women's Month celebration for the month of March. Magiging excited dyan ang ating Gender and Development Coordinator, Sir Rachel Capuno. And then on April, we also have our webinar, which is entitled Looking Good, Am I Right? O, diba? That is, our focus is on the magnetic resonance imaging. And last and definitely not the least, we have our webinar for month of May that is entitled Kilig to the Bones. So our focus is on the orthopedic orthopedic imaging. So keep updated, guys, with our page, UEP RadTech fan page. So to the third year students, this is very much exciting part is that your webinar series will be converted into your seminar portfolio. Yeah. So the submission is or will be on before the final examination. So you are going to compile all your outputs of the webinar series. And of course, to our level 4 students, the most exciting part is of course, this webinar series is incorporated in your professional development. Of course, kailangan nyo din gumawa ng training seminar portfolio. So alam nyo na yan because you already have an experience about it. So again, thank you so much for our participants all throughout the world. So keep updated with our webinar series that will be posted in our UEP RadTech fan page. Thank you so much, everyone. Bye and happy Heart Month celebrations and all.
Hello, everyone. We would like to inform you that in order to streamline our attendance progress, we have implemented a QR code system. This QR code will serve as your digital attendance record for this webinar. Once the link is opened, you will be directed to a web page where you can confirm your attendance by filling out a Google form. Thank you. Miss President will comment the link in the comment section.
Thank you, Sir Gilbert.
Thank you, Sir Gilbert Pedroso, as well as Sir Reuben Revillas. Thank you, sirs. In exchange for your participation in this webinar, mag-fill out na lang kamo na Google form gamit ang QR code. And with that, we bring today's event to a close. Thank you, everyone, for being part of this memorable gathering. I am Christine Erica Go, your today's MC. We hope to see you soon again. Good day.
Stop share ka.
Everybody, my mom and dad. Everybody, my mom and dad made this juice all from my studio. I'm gonna play my verse. Let's go!
Thank you so much.
Bye, everyone. I tried to let you go so many times before. Then I got back
Bisa nag-brown out. Bisa nag-brown. Brown.
every time I
Thank you so much, Sir Gilbert.
There's nothing better I could change. Every time we try to be friends, it always ends the same. But we're gonna try to live and love. All the pain we've been through. Don't care me, say whatever. It brings me back to you. Don't know, I tried to let you go so many
Open hand.
Puro mga vlog. Vlog si Karen yan. Parang nagkala. Wala ka? Karen yan. Klaro yung kita.